Hello, everyone. I'm so happy to see you all here today. My name is Rebecca Wallace, although I just got married and I am changing my name. But you know me as Rebecca Wallace. Um, I am the board chair for the IFOPA, and my son Eli lives with FOP. He's 16 years old. We are in Madison, Wisconsin, in the United States. Um, this is my sixth year on the board, and it's been a real honor to be able to work on this strategic plan, and I'm so excited to share it with you today. I also have some other special people who are going to be sharing today, and I'll start with our vice chair, Nadine Grossman. If you'd like to introduce yourself.
Yeah, I'm from Germany. I live with FOP. I also do research on FOP and a couple of other volunteer things, let's say. So I'm happy to be here with you today.
Great. Jamie?
Hello, everyone. I'm Jamie Roach. I am the operations director for the IFOPA. I've been on the team for about 3 years, and I'm based in Kansas City. Really happy to be here.
Hope.
Hello, everyone. My name's Hope Newport. I'm the Family Services Manager at the IFOPA, and I have been with the community for 7 years now.
Michelle.
Okay, so hello, I'm Michelle Davis. I'm the Executive Director of the IFOPA, and I have been here since 2016, so for 9 years now.
That's awesome. All right, well, we will get started sharing with you. I think Michelle is going to kick it off. We'll share some slides here.
And if you need translation services, Hope is monitoring the chat. So if you need translation, there is the link. She's providing information about how you will access those services. I think the other thing I just want to say this morning before we get started is I think Rebecca mentioned it. We have a strategic planning committee and the board of directors that have been working very hard on this plan. And it's so great to see the response from the community. We have this morning, we have people from 4 continents. We have people from Europe, Australia, the US, and Africa on the call this morning. And so I think that really just speaks to what we've really been striving to do is to be a globally serving organization. And so we're so excited to have all of you with us. I think in total for the events today, we've had people register from like 19 different countries. So it's pretty amazing, your engagement in our work and your support of our work. And so I just wanted to start by saying that this morning that we're really grateful. So, okay, let me get these slides up and then we will get started here. And we will have time for questions. So we'll probably save those till the end. So if you or if you want to put your question in the chat, as it's like if it comes to you during the presentation, then you can put that in the chat as well. And we're glad to address your questions. So if there are questions that are more of a personal nature, that might be something that we will need to just address on a one-off basis, but we'll definitely take your name and follow up with you. So, okay. So I think the big question that we really want to start with is why did the IFOPA and all of the work that we're doing, why did the board of directors decide that we should pause from our work and really spend some time and some resources doing strategic planning? So on this slide, I know it's tiny, you can see a very quick overview, a short abbreviated overview of the history of the IFOPA. We were founded, we just had our anniversary on June 8th. We were founded 37 years ago. Family fundraising started in 1990. And the big thing that really happened for us was the announcement of the discovery of the gene mutation in 2006. And then from there, you can see in green, after the gene discovery, all of the things that have been happening. And you can see the natural history study and the first palovarotene trial. And then in 2015 and 2016, the IFOPA stopped into the strategic planning exercise because they knew, thanks to the gene discovery, thanks to the first natural history study and the other research work that had been happening, that there was a lot coming. And I think what you can see in that right column, what we really want you to see is that a lot has been happening. Everything in green are clinical trials that have been happening in FOP. But we knew that once a drug, the first drug was approved, that we would learn from that process. We would learn what does it mean to go through a drug review, to go through then how do patients access the drug once it's approved? What does it mean when there is a drug approved in several countries but not in other countries? And so the IFOPA board really felt like this was the time. We didn't want to do it too early, but we wanted to wait until we had lived out sort of the drug review and approval process to see what that world was like and what the needs of the community globally would be. And that's when we decided to stop now last fall and go through our strategic planning process. If you want to see more about the history of the IFOPA, you just go to ifopa.org/history, and you can see more about it there. So I mentioned that in 2015 and 16, the IFOPA stopped and did strategic planning. I joined shortly after that strategic planning exercise had started. And then the other staff that we have here today, some of whom you've met, all were hired as a result of that strategic plan. That was the goal of the strategic plan, was to bring on staff who are subject matter experts in a variety of areas. Hope's a child life specialist. Melissa's an occupational therapist. We have a research director who will be announced soon, who's a PhD scientist. So we started bringing on staff to fulfill that strategic plan. So some of the work that's been achieved since that last plan in 2016 is the Drug Development Forum. It is the only conference, scientific conference in the world focused on FOP, and we've done 5 of those in the last 9 years. We have also, again, just in the last 9 years, we have given away over nearly $7 million that funded 33 different research grants. And that is because donors like you, fundraisers have helped us generate that revenue to make that $7 million in research grants possible. We have also been able to provide direct support and services to hundreds of individuals and families. Some of you that are on here today, I know that you've done welcome calls with Hope, or maybe you've sat with Melissa as she has walked you through what are some of the tools or home modifications that you might need. The other big thing that we've done is 9 FOP family gatherings. And you may remember that during the pandemic for 3 years, we offered a series of virtual or hybrid family gatherings that were attended by people around the world. And then the other thing that's so exciting is the launch and ongoing support of 7 clinical trials. We knew that with so many clinical trials and a small population of about 1,000 known patients in the world, that it would be a big task to be able to recruit all of those trials, but you did it. Like, we did it together, and those trials have all been filled. And then the last thing that's happened, and you all have been a part of that too, especially if you're a part of the FOP registry, completing those enrollment surveys and those follow-up surveys every 6 months, we have now grown that registry to have 10 years of data. And from that, we are able to produce IFOPA-led research. So there's research happening in labs around the world, but there is also research that the IFOPA has led. One is the prevalence study that we did in 2020, where we learned that the prevalence of FOP is actually 1 in a million. It's not 1 in 2 million like we previously thought. It's a good thing to be, we're still rare, but to be 1 in a million is more attractive to researchers and drug developers. So that's a great thing. That's an example of the kind of information that IFOPA-led research has found. So a lot has happened since that first strategic plan. And that's really brought us to where we are today, where there have been a series of active clinical trials, and that's been very exciting. It's unusual for a disease that's 1 in a million for there to be so many clinical trials, but we know that there's great scientific interest and there's great trust by scientists and drug developers and the community that's been built here at the IFOPA. And then that resulted, the next thing that's happening is the review of those drugs. And the work that's being done to help ensure access to new treatments. And not all of that is being done by the IFOPA. For example, FOP Australia, that's here on the call today, they did tremendous work when palovarotene was being reviewed in their country and then going in front of their pharmacy benefit committee to ensure that patients in their country would have had access to that. And so now we really live in a place where we want to continue to support these clinical trials. We want to continue to support review and approval and access. But we also want to think about what's the new research. You might call it, FOP Research 2.0, but it really actually feels like it's probably like 5.0 because we're at a place where we're starting to think about, goodness, if there could be drugs approved that stop bone growth, what could we do then? Could we do surgery? Could we look at mobility recovery? So that's really the place that we're at today when the board stopped and thought, okay, what should we be doing next? So Nadine, I'm going to turn it over to you.
Yeah, thanks, Michelle. So there were a couple of questions which we wanted to answer, so I would just run you through them. So first of all, we really wanted to hear what are the priorities of the FOP community. So we really wanted to hear what is important to you. And we didn't want to reinvent the wheel, but really also see what do other successful patient organizations out there, what do they do, and how can we learn from them? Then what is our unique role, which we should and can play? And then, since we have limited resources, so on the one hand, limited time, and on the other hand, limited funds, we really wanted to see where should we put the focus with those limited resources. And then with these limited resources, how can we still have the highest impact possible? And, our community is very diverse. And just to call out here a couple of different stakeholders, and this is in no particular order, so all of them have the same importance. We have here on the call, we have individuals living with FOP, we have families, then of course doctors, they're like super important, the National FOP organization, donors, as I said before, other rare disease organizations, then our amazing researchers and pharmaceutical companies, and of course the fundraisers. And then to our mission and vision. So if you have been to the IFOPA website, you might know this already. So our vision is really that we want a cure for FOP. And I think the important point here is that it's really accessible worldwide. And we slightly adapted our mission. So the mission is now that we support and connect the global FOP community while driving research toward treatments and a cure. Before it was funding research. So now we slightly changed this a little bit. And then to our core values and operating principles. So I will not read through all of this, but just to give you a really high level overview. So the core values is really how we approach our work, and maybe just to call out compassion, because for me personally, I feel compassion is very important. And I feel that the IFOPA does a tremendous job, like all the staff, everybody working, all the volunteers, I feel everybody's really compassionate, and actually passion, I will add here too. And then for the operating principles, so it's really the work we do. And again, for me, I guess personally, since I'm also a patient, I feel patient-centered is always very important. Plus, since it's the international FOP organization, that we are also operating globally. And so the process, it was a 2-month process where we engaged with community members. And maybe some of you here on the call actually participated in the online surveys. So we received responses from over 100 people, and I think that's amazing. So also thank you here to those who did participate. And these responses were really made up from different stakeholders. So, what I showed you before, individuals with FOP, family members, pharmaceutical company, FOP researchers, doctors, and so on. And it was really that we wanted to hear your feedback on the existing priorities which we had, and then really identified what is important for you in the next 3 years. We also connected in one-on-one interviews with over 30 individuals. And this again was not only within the FOP community, but also, as I said before, with other peer organizations, because we really wanted to learn from them, how are they so successful. And then we also hosted 5 focus group, and this was focused on individuals and families that are directly impacted by FOP. And here we really made sure that we also included the different life stages, because everybody is in a different stage, and we really wanted to make sure that we cover all the stages so that we can really understand the experiences and priorities in these different stages. And then as last, the strategic planning committee and then the board of directors, we reflected on all of this feedback. And the goal here was then that we define the priorities to, then be responsive to the communities and partners' needs. Oh, sorry, is this still me? Okay. So then what we heard is 5 things actually. So the first one was that the IFOPA is really seen as a comprehensive one-stop shop. So this means that at the IFOPA, this is the one place where you can get all the information. It's not that you have to go from A to B to C and, gather all the informations on your own, but this is really like one place you can go to. And especially the family services team. So here, shout out to Hope. They were really highly valued and appreciated. And I think you can probably echo that if you, were in touch already with Hope and or Melissa or had one of the welcome calls. Then, and this is again, especially I think also for me important and nice to see that the IFOPA is really seen as someone that brings people together and that we have one unified voice. And I think this is really, really important and nice to see that we actually did manage to do that. And if you think back to our last or this year's awareness campaign where the theme was stronger together, I really do believe that we are stronger together. And, we really see this also in the community that we have this shared values. And then also over the last couple of years, that the investments in organizational capacity that they have transformed in a positive way. So for those maybe who have been already involved with the IFOPA, I don't know, for the last 10 years or so, you will really have seen the change that happened, especially ever since Michelle was brought on. And then the IFOPA is also seen as an unbiased partner and convener, between the different stakeholder groups. And I think that's also really nice to see that we have this strong role to bring together the different stakeholder groups. And then, as Michelle said, the FOP registry, which is celebrating the 10th anniversary this year, this is really seen as a highly valued resource. And this really puts us in a unique place.
You see your mouse moving, Michelle.
I was going to say thank you, Nadine. Rebecca, do you want to go jump in?
Yes, I can take over from here. Thanks, Nadine. Continuing along the lines of what we heard from our people community who responded to all of our wonderful asks. So here are some areas for investment and improvement that we heard about. As our FOP-related research continues to progress and expand, there's a desire to have a greater scientific advisory capacity. So there are so many opportunities for scientific research, clinical trials, and it just seems to continue to be growing, which is fantastic. And we just want to make sure that we have a strong scientific, people advising us with a strong scientific background who can help the IFOPA prioritize which of those paths forward we are able to support to advance these research activities. Speaking to our diverse population that we have talked about a few times already, since our community is made up of people all around the world, different ages, different stages in their FOP journey, and different sort of relations to having FOP, just being mindful of that diversity and recognizing that we can't always meet every need for every family. But we do want to make sure that we're communicating really clearly what we are able to do, and also the limitations around that, and so that we're setting reasonable expectations for our community. And again, given that our community is so small, strong partnership and collaboration is really important. So there are multiple FOP serving organizations. And since the IFOPA has this kind of international role, we can really be a catalyst for driving more collaboration there between the various groups who are focusing on FOP. Bless you, Michelle. So here are some opportunities and future priorities that came up. One is that as progress in the field advances, we really can start looking at ensuring equitable access, making sure that treatments are available once they, doesn't really make sense. Once they're available, make sure they're available to everyone in our community. Also, taking some time to really evaluate the outcomes and the return on investment of our various programs and services and research activities. So again, there are so many things that we could do for our community, and they're all valuable. But if we really pay attention to maybe which events are, highly attended, or which research priorities really seem to have a lot of impact, by assessing those things afterwards, we can better make decisions moving forward of which types of activities we really want to focus on, so that we're just having the highest impact, like Nadine mentioned. As additional clinical trials come online, it's going to be so important that we continue to have these, to be a supportive partner to pharmaceutical companies. We want to keep encouraging their work in the FOP space. And so our role as partners to those companies is going to continue to be really important. And then also identifying and educating more doctors to engage in FOP care. The more patients that are identified, the more potential treatments that come online, the more trials there are. We need more healthcare providers to be more educated about FOP and willing to support patients in their FOP journey. So here are some priorities for research and drug development activities that we heard were important. Overall, the IFOPA is seen as an incredible partner, driving our research through our grants program. And Michelle spoke earlier about the $6.6 million in grants we've been able to offer over the years. But the value of those is greatly expanded just through the partnerships that we are able to leverage, and really making sure that those funds are used in a way that really, I'm losing my words this morning, but we just really want to expand how they can be used. We're also going to be focusing, or sorry, it is requested, and we will be focusing on robust competition and scientific and merit review. So I think I mentioned that earlier around having this advisory component, so that all of our research grants are really well vetted, and making sure that we're really further growing our research field and supporting those high impact research goals. Broadly, many people were interested in us playing an even greater role in driving data sharing and collaboration as it relates to drug development. That is a fairly unique role that the IFOPA can play. And then, of course, people have varying ideas and perspectives about how we should be directing our future research activities. But two things that seem to be sort of a common topic that came up. One is, given how much we have learned from basic research already to date. Sorry, I'm losing my screen here. When we're investing in basic research in the future, really having some targeting any strategic gaps that are there versus some of these broader topics that may have been studied in the past. And then also in parallel with clinical trial activity, our community is really interested in seeing us invest in translational research, investigating off-label drug research, and then exploring surgical approaches to mobility recovery.
Okay, thank you, Rebecca. So I think one of the things before we dive into the specifics of the projects that we're going to be working on over the next 3 years is one thing that we wanted to share that became abundantly clear when you think back to the slide that Nadine showed, where it showed all the various members of our community. In some disease organizations, you will see maybe the organization is set up and all they do is patient services, or maybe an organization is set up and all they do is research. And so in those organizations, they like have to find other partners to work with. But the way the IFOPA was started, in 1988, when Jeannie Pieper and Nancy Sando really were the founding member of the organization, when they started the organization, their initial thought was, how do we support families? How do we support one another? And then 2 years later, when the Bogard family decided to do the first fundraiser, the idea there was, okay, what research needs to be done so we can work on treatments and hopefully one day a cure. So that really brought all of the pieces together under one umbrella at the IFOPA. And now we partner, with the international organizations around the world, like FOP Australia, that's on here on the call today, or FOP Stichting Netherlands, who was also on here today, or FOP Italia, who's on here. So we partner with other national organizations as they do work in their local communities. We also have partners through the International Clinical Council on FOP, which is the body of FOP experts, with 10 soldiers, who is looking to find patients. So we have partners that we do this with. But what really is important is that it's like this ecosystem. So the IFOPA really starts by supporting and connecting and advocating for individuals and families. And when we work with you more closely, we learn about the needs of the community. And so we can, represent those needs to researchers and to pharmaceutical companies that are studying FOP. Sometimes we ask you to sit on panels or to take a survey that helps us give that information, share that anonymous information with researchers and pharmaceutical companies. And then they take that information and they do research and they develop treatments to serve the FOP community. And then once those are developed, then we have the pipeline back to patients that allows us to share with patients about up and coming treatments or treatments that have been approved, clinical trials. And also what we found in this whole strategic planning process is that a new component that's become really important now that there is a drug that's approved and hopefully others coming is a relationship with the doctors, to also be able to share with doctors about what is available and how they might use it with their patients. So there's really 3 goals that we're going to talk about. The first goal that we're going to talk about is our work in continuing to drive scientific advancement. Our second goal is around serving individuals with FOP and families around the world. And then our final goal is around taking the role that we have as the largest FOP organization and really being a convener, driving greater collaboration among stakeholders. And we'll talk a little bit more about who those stakeholders are in a few minutes. So we'll start first with what are we going to be doing over the next 3 years to drive scientific advancement for FOP care and treatment. So the first thing that will be happening is that we will be developing an updated research strategy. So since before I got here, there's either been a research consultant, that was Betsy Bogard before I arrived, and then we had a research director, 2 research directors, Adam Sherman and Danielle Kirkovic, and who are no longer with us, but we have just recently hired, we'll be announcing in the next couple of weeks, we'll be announcing the hire of a brand new research director who comes to us with background working in another patient advocacy organization, another disease, where he's been a PhD scientist, but he's also worked in pharmaceutical companies. So we're really excited about the experience that he's going to bring to this role. So he's going to sit down and he is going to talk to the key opinion leaders, the FOP experts who are doing research, but who are also caring for patients. And he's going to learn from that and from literature review, what are the gaps And then we're going to work together to prioritize the gaps in research. That's where we want to invest our funding. He's also going to make sure that the grant programs that we offer, if you think back to the operating principles of the IFOPA, one of those operating principles is around best practices. And one of the best practices in reviewing grants is that they all have scientific and merit review. So he'll be making sure that our grant programs have a review process, and that we're really focused on how do we really prioritize high impact research goals. We don't have all the money and all the resources in the world, so we do have to prioritize. He'll also be working with Sammy, our real world evidence manager, who works on the registry. Some of you have probably interacted with Sammy before on the registry, and making sure that we are putting out into the research space IFOPA-led publications that we are getting either from research studies that we do as a one-off or research that comes out of the registry. That's really important because as drugs are being reviewed and approved, and as either governments or insurance companies are deciding whether they're going to pay for a newly approved treatment, these different bodies go and they start looking in the published research to see what is known about this disease. What are the challenges of living with this disease? What has been done over the years to care for people with this disease. And so the more information about the challenges of living with FOP, the burdens of living with FOP, the disease progression that we can put into the published research, there's more things for these regulators and these what we call payers to look at so they understand how important it is that they prioritize approving these drugs and making them accessible to patients. And then lastly, as I think Rebecca mentioned, or maybe Nadine mentioned, that we will also make sure that, over the years, the work that the IFOPA is doing and the research that we're doing is becoming more complicated. It's becoming more complex. As more is happening in the research space, we're doing bigger and more innovative things. And so we want to make sure that we have the scientific advisory capacity to help us make decisions about what we're doing in research. There will always be a patient voice, always be patient members and family members on that research committee, but we are at a point where we need to bring in more scientific advisors. So the next thing that we're doing around scientific advancement is making sure that we continue to prioritizing the clinical trials and making sure that information about the clinical trials gets to families around the world. You may not live in a country where there's a current clinical trial, but we want to make sure that you understand what is happening, that you're kept updated. If there is information about off-label treatments, we want to share that information with you. So we've done things like the clinical trial locator map, putting descriptions of the clinical trials on our website with contact information for the principal investigators of those clinical trials. So we'll continue to grow those resources and making sure that they're updated and that you're aware and using them. We mentioned that this is the 10th anniversary of the FOP registry. We have about a third of the world's known FOP population enrolled in the registry. If you've heard Dr. Kaplan talk or others talk, they say that there's about 1,000 known patients in the world living with FOP. So we are lucky to have about a third of them enrolled in the registry, and that's thanks to many of you who participate every 6 months. We're going to continue to invest in the registry. What else can we be doing to grow the value of the data? Are there ways that we can reduce the burden on you as patients or caregivers in completing that? But what are the needs in the community in the research community around the disease state that we can answer through the registry? And then we'll also make sure that we are working either in direct advocacy by the IFOPA or supporting others as these drugs finish clinical trials and come through the review process. So when palovarotene was reviewed in the United States, Hope worked very diligently to put together a group of people that testified in front of the U.S. Food and Drug Administration about the experience of living with FOP. We also created an opportunity for people from around the globe, which many of you did, to write letters to the FDA to talk about the disease experience and why treatments are so important. And as they made the decision that day, as they made the committee made their recommendation, one of the things we heard as they answered how they were going to vote is they said, we learned from the patient testimony today that even small incremental change is important to patients. So they really are listening. So now we have sort of a playbook. Like we know the things that are important to put together as drugs are being reviewed, so we can help people in other countries as drugs come before review bodies in their countries, we can help them better understand what are the important things that you need to highlight and the opportunities you should give the patients in your country to say to these review bodies. I know that when FOP Australia was working on that, we shared some of our resources with them, and we hope to be able to continue to do that in the future. So there's a lot happening in scientific advancement for FOP care and treatment. Our vision is a cure for FOP that's accessible worldwide. And that's where we spend the majority of our budget and the majority of our focus. So the next goal that we have is around individuals with FOP and families. So there's a lot that has happened. As Hope said, she joined in 2018. So over the last 7 years, there are a lot of new programs that have been built. There are some old programs that have been expanded. And so we're excited as we look to the next 3 years, we will continue to prioritize the development and refinement of programs around care management and educational resources that are about things like FOP and immunizations, FOP and the flu, things like safety and FOP. So those are some of the things that we've been doing in recent years. There's also a mental health program, Resilient Living, that Hope has spearheaded over the last several years. So we will continue to prioritize and develop and refine those programs. And you'll be seeing, I'll kind of skip ahead to objective 2.3, but we will be doing some evaluation of our existing programs and resources. So we really hope that as you see these opportunities shared in one of our e-newsletters or maybe on social media, that if you've either been participating in these programs or if you have an idea for new programs, that you participate in these surveys and tell us what best serves you. We will also be continuing to look for how do we create opportunities for connection. So over the years, we do the family gathering in the United States. There are family gatherings that are led by FOP organizations around the world. You might have seen on social media that this last weekend, the Canadian FOP Network had their first meeting in several years, which is great. We know that FOP Australia has a meeting coming up in August, which we're very excited about. It's the first one for them in quite a few years, so that's great. Other groups like FOP Germany and FOP Italia are able to do an annual meeting. So on our calendar of events, we always share these programs to make sure that people know there's something in their country or something close. We look to our support groups as a way to create connections. So we'll be continuing to survey and talk with people around the world about what are the ways that we can help support even local community organizing in a variety of countries. And then I think the last one, which is really important for us to share about, is the need to build out a global network of healthcare providers. So many of you, we hope, are aware of the International Clinical Council on FOP. It is a group of FOP experts. I think there's about 20 to 25 of those experts that are in countries around the world. Some countries have a couple of members that are a part of that. They've been caring for patients for many, many years. So some countries have multiple experts, some countries have one, but there are many countries where there isn't an identified FOP expert. So first of all, they are creating the FOP treatment guidelines. These are the materials and the speakers that we use for our educational resources. But they are also a place for your local healthcare providers who may not know as much about FOP to connect with and learn about how to best care for you. So one of the things that we want to do is create on our website, like many other patient organizations have, a directory. So in the United States, there would be a directory by state. So there actually is someone in the state of Colorado who she's not a member of the International Clinical Council, but she's cared for 12 FOP patients. So we want to make sure that Dr. Elias is listed in this directory. There's a center in Texas that's cared for about 5 FOP patients. So we want to make sure that they're there. But we might have someone in Missouri who only cares for 2 patients, but they know those patients well, and they're willing to be listed on that directory. And then we'll be looking for you to help us identify people in your country that are maybe a doctor that you value, who you have a good relationship with. We hope that you'll help us connect to them so that we can ask them about their willingness to be listed on the directory. There may be other patients or people when they're newly diagnosed that can come to our website. We know that people, when they're newly diagnosed, they come to our website and they begin to look for resources. And so for them to, they may not feel like they're ready to make a phone call or to send an email or a Facebook message to outreach to us, but having that information up and accessible on the website is super important so that they have access. One of the things that we know is that when drugs are approved, that you need either a provider in your country or in the United States, you need a provider in your state to write you that prescription. And so if these these researchers have worked so hard to research FOP and these drug companies have worked so hard to develop treatments and get them approved, we want to make sure that there is a network of doctors out there who can actually prescribe the drugs. And so we'll really be working with you to identify who those doctors are. We are looking at other places like the Rare Bone Disease Network, the National Organization of Rare Disorders, your Rortis, places where we can identify doctors who care about rare diseases that are willing to learn more about FOP. So we're really, this is an area that before drugs were approved, we didn't know was going to be an issue. And so we're glad that we paused and waited for the drugs to be approved before we finished the strategic plan so that we would know this is a need in the community. And then the last goal is around convening and driving greater collaboration. So the first thing that we'll be doing is making sure that really is a foundation for effective collaboration. So we'll be working with other FOP organizations to make sure that we are sharing our resources. So a great example of this is FOP Friends in the UK. They've created a school book for parents, a book for them to share with their schools to explain about FOP and what some of the children's needs might be in a school setting. So that book has now been translated into Portuguese. It's literally in the process right now of being translated into Chinese. So they've created this wonderful resource. We don't need to duplicate that effort, but we want to make sure others are aware of it and that they're able to use that resource. So that's one example of the way that we work together. So through there's a network or a committee of national organization leaders called the International President's Council. So we'll continue. We've been partnering with them since they started in 2007, and we'll continue to partner with that important organization. We also partner with the International Clinical Council on FOP, which is currently led by Dr. Patricia Delay. And then we also partner with 10 Soldiers, which many of you likely know, an organization founded originally out of South Africa to help identify patients who have not yet been diagnosed. And they're also developing educational programs for doctors. So we use those, all of those groups, we partner with them so that we can better serve the community together. We'll also continue to foster the capacity of the country-specific patient organizations. We've learned recently through the recent Global Awareness Day campaign that there are more FOP organizations, especially in South America, more organizations that are popping up. And so what can we do to share resources and to mentor and to be supportive to both the established and long-running organizations? Some of them have been around 20 or more years, to these new organizations that are popping up as well. And then the last thing that we'll be doing around convening and collaboration is really prioritizing opportunities for researchers, doctors, and drug developers to come together. It is super important that these groups come together and they talk and they learn from one another. The FOP Drug Development Forum was started in 2014, and it is an incredible opportunity for them to come together in what I would sort of call like a safe space where people aren't there to get ideas and steal ideas from one another, but really to sit there and talk about what is important to patients, and then to talk about the work they're doing. And we've seen partnerships come out of this before. At the 2016 Drug Development Forum, a collaboration came out of someone on the West Coast in San Francisco and someone on the East Coast in Boston who never probably would have worked together before. So we want to continue to prioritize, and we'll put research dollars into making sure there's an opportunity for those individuals to convene, and to share resources and to identify what more can we be doing to support them in their collaborations. So some of the work has already started in the rollout of the strategic plan. So the IFOPA has a person. You may have seen recent announcements. There's a really cool interview that was just posted on social media, where we've introduced you to Brian Miller, who is our development director. Brian Miller is a person who supports family fundraisers. So whether you live in the US or if you live outside of the US, if you are an FOP family or an FOP friend who wants to fundraise for the organization to help support the launch of the strategic plan, Brian is here to help you fundraise. We have resources that we can set up for you, personal fundraising pages, or we can provide other resources to help you fundraise. But he's also going to be focusing on working with individuals and people who want to make large gifts to the organizations to support these projects. As I shared earlier, I kind of let the cat out of the bag. We've filled our open research director role, and we'll be announcing in the next couple of weeks the person and sharing with you, giving you more opportunities to meet him. As we've been putting together, we spent a lot of time in August, September, October, even November of last year, as Nadine outlined, really collecting information. And thank you to many of you that participated either in the written survey or maybe a small group discussion. You shared information with us about what was important to you. That's how we learned about things like the importance of the healthcare provider directory. And so now we are sharing the information about what we're going to be doing with these groups back. So we have met with, the groups we've talked about already that we're collaborators with. We've also had a meeting with former board members, our emeritus advisors. We had a meeting in early June. Nadine and I did a meeting with researchers from around the world. And we're also meeting with each of the pharmaceutical companies to share with them the projects that we're going to be working on so that they know that we're here to support them. Again, one of the big needs that I would say was a little bit surprising to us, but is super important, is this work around healthcare providers. And so one of the things that we've done, Melissa Davis is an occupational therapist, so obviously she's very familiar with the healthcare system. She is going to be working with us to help identify and then share information and resources with healthcare providers and make sure that the healthcare providers that we are bringing closer to the IFOPA are also connected to groups like the ICC. So Melissa's title has changed. Her title is now Family and Provider Support Coordinator. The other exciting thing that happened is that we launched an e-newsletter for medical providers. So we did some survey work with them and asked them, how do you want to learn more about FOP? How do you want to stay connected to groups like the ICC? And an e-newsletter, which was something we hadn't done for them before, was the top thing that they said. So we've sent out 2 editions now. The first one had over a 60% open rate. So people were super interested in that information. It was a 20% click rate. Like in most industries, like a click rate is 2 or 3%. So people were very interested in the content. And then we had no one unsubscribed from that newsletter. So people are eager. People that are caring for FOP patients are eager for this information. So the next thing we'll be doing now that the research director is hired is we'll be really building out the research agenda. And we'll also be expanding the scientific expertise on the research committee. And then we'll relaunch brand new kind of updated grant funding programs. We have been doing grant funding over the last several years, but we're going to be relaunching brand new IFOPA grant funding programs. So there's lots of other things that are happening. In addition, some of the research work and the survey work around our family services programs, those will all be happening. But these are just some of the highlights of the things that we'll be working on. So Rebecca, do you want to finish and then we'll go to questions?
Absolutely. Just have to thank everyone who was involved in this incredible effort. More than 150 community members provided feedback. That's just so exceptional. And our strategic planning committee and board of directors also played a role in just reviewing everything that everyone commented on and is happy with or would like to see improve or is requesting for the future. So just a huge thank you to everyone who is involved in any way to make this possible. I'm very proud of the effort and the end result and just really excited to be implementing this plan for the next 3 years.
Okay. So we'll open it up to questions. If there are questions, if you have a question, you want to put it in the chat, that's great. Or if you want to take yourself off mute and ask a question, we can do that as well. So it looks like one of the questions is from Gretty. Gretty is a former board member, so it's great to see you here today. So Gretty's question is about cuts from the current U.S. administration to the FDA. Are those affecting our research strategy? So a couple of important things to kind of share here. So one is that the IFOPA itself does not receive any government funding. So we are not impacted by any NIH cuts or NIH or research cuts that have happened at the government level in the United States. We are getting ready to launch a survey to researchers both in the United States as well as around the world to ask them about this, to ask them about the current state of their research funding. How are the changes in the United States impacting their research? And what are they doing to sort of recover from that? What changes are they making? And then also to researchers outside of the US to learn more about how they are funded. We don't believe the changes at the FDA with the structure of the FDA are going to impact the review of drugs. Many of the drugs are a part of the orphan drug program, and we think that that's pretty stable at this point. But the pharmaceutical companies that we work with and we meet with every month we meet with the pharmaceutical companies that have active clinical trials in FOP. So we really stay in tune to what's happening with them. And so they have, they're big organizations with government relations staff. And so they're closely monitoring and advocating at those companies so that the cuts don't affect the work that they're doing. So for now, we feel like that feels pretty stable and safe. But we'll learn more, especially about the NIH cuts. And thank you, Rebecca. She put in the chat, NIH stands for the U.S. National Institute for Health. That's the body within the United States that provides a lot of research funding. So we'll be learning more about the impact on U.S. researchers through that survey. And then I think there's a question from Lydia, who's from Australia. We're glad you're here. Two questions. So yes, we're actually recording these presentations today. We're doing the presentation 3 times. So we're recording those and we'll be taking one of those presentations and then putting it up on our YouTube channel. So it's just youtube.com/IFOPA. We'll be putting that on our YouTube channel and then we'll be sharing it out through our e-newsletters and on social media that it's available. And then we will have a condensed kind of version, more of a narrative of the strategic plan that we'll be posting out to the community as well, so that you can share that with your communities so that they're able to stay informed about what we're doing. And we will also, if you may have seen, so the IFOPA now does, in addition to the newsletter for healthcare providers, on the first day of every month for FOP families, we issue what's called FOP Community Updates. And that is our family newsletter. One of the key features of that newsletter, why it's limited to just families, is that it has birthdays in it. And so that's something that we celebrate internally, but it's not really public information. Families aren't obviously maybe comfortable with that being in a public place. So we have this internal families newsletter. And then we have about the third week of every month is FOP Connection. And that goes to families, it goes to researchers, donors, anyone that wants to sign up for our e-newsletter. We have that. And then we also have something called FOP Pulse, which features just our family services programs. So we will be, over the next few years, as we're really living through this strategic plan, we will be sharing updates about the things that we are implementing that are an important part of this plan. And then let's see. So great question from Maria about, are there ways for us to participate more actively in some of these activities? Will the committees continue to exist? Absolutely. One of the operating principles of the IFOPA is that we are board-led and staff-driven, but we also have a variety of committees that really support the work of the IFOPA. So some of you might have applied for a Life Award. The Life Awards program has a committee that reviews those. We have the Awareness Day committee. I know Maria, that's on the call, and who asked this question. She was a part of the Awareness Day committee this year. So yes, we definitely will continue to have opportunities for community members, whether you're a person with FOP or a family member, or maybe you're just a friend of the community, to be involved and to serve on these committees. So those will continue to operate. And again, through our e-newsletters or in social media posts, that's where we'll make people aware, of these opportunities. So I think there's a question about, how can people outside of America get access to approved medication? So this is a tough question. So within each country around the world has what we call a regulatory agency. And that is a group of individuals that's been put together by that government that decides which drugs are approved and can be offered in that country. And so wherever you live, there is a regulatory agency. Hope and I are working on some resources that we'll be sharing very soon about sort of the drug review process. And one of the tools that's in that is a link that shares from around the world who all of the various regulatory agencies are in each country. And so the pharmaceutical companies, as they are developing these drugs, will go to the regulatory agency in the country and ask them to review and approve that drug. So that's what's going to be an important part of the step. So in the end, it's up to the pharmaceutical companies to decide which countries they're going to apply to get the drugs reviewed. We're here to advocate and to help teach you how to advocate for these drugs to be reviewed in your countries. But that can only be done once the clinical trials are finished. So right now, there are 5 active clinical trials. And we are waiting for those clinical trials to finish before they'll start being reviewed. So, right now we're sort of at a standstill while we're waiting for the drugs to finish the clinical trials. Other questions? I think one other thing I'll share is that, and I'll put it in the chat, there is an email address that's just a super simple email address. It's together@ifopa.org. So if you have questions following today's presentation that you want to ask, something that you thought of, or maybe you didn't want to ask in front of the whole group, feel free to send an email to that address, and we'll get it to the right person and make sure you get an answer. Any other questions? I think we started off the call by saying there were 4 continents represented. I think by the time we finished, 6 of the 7 continents were represented. So that's really great. What a great way for us to start the day and for some of you to finish the day. Well, I hope that you know that here at the IFOPA we see the global FOP community as a family, and that we all treat each other like family. That's an important, priority and goal for us here at the IFOPA. And just like you would care for your family members, that's how we approach the work that we do here, whether we're board members or whether we're staff or volunteers for the organization. And we've really put this together because we want to do what's in the best interest of the community and help fill the gaps where we can, and to help strengthen others in doing the work either locally for their organization or for their family. And that's really the intent and the heart of the strategic plan. So it takes resources to do that. And so, we're proud of the way that the community rallies, whether it's through the Awareness Day campaign or whether it's through the In Pursuit of a Cure Day of Giving, or even at the end of the year, the way the community rallies and financially supports the organization, and not just people in the United States, but people from around the world. And so we hope that whether it's through a direct donation or a fundraiser, that you will choose to be supportive of the work, and help us invest in this work because we can only do it when we all do it together. The next big thing that is coming from the IFOPA, so be on the lookout. In the next couple of weeks, we'll announce the new research director. There will be opportunities for you to learn more about him and the work that he's putting together. And then on September 16th, so every year on the third Tuesday of September, we will have Day of Giving. And that is the campaign where 100% of what is raised funds FOP research. And that is research either here that's happening, any of the research that we do. So that might be publications work that we're doing. It might be around the registry. It could be around research grants that we're funding or a biobank. So a variety of research projects. All of that money that's raised during Day of Giving funds that research. So it's a super important campaign. And there's lots of ways to be involved. So starting August 1st, we'll be talking about it and sharing ways for you to get involved no matter where you live. So we hope that you'll watch for that and take a part. It's a really special day. So again, thank you so much for being here with us today. It's our pleasure to work with you, and we hope every one of you has a great day. And when this comes out, that you'll share it as well with others in your community. Thanks so much for your time today.